We are back with another cost comparison for you. We have a fancy new electronic whiteboard of sorts, and I am going to be drawing out what you could be looking at if cancer strikes while you're on Medicare. I need to preface this with this topic hits close to home for me. When I was 7 years old, my mom was diagnosed with breast cancer, and she was given 5 years to live. Miraculously, she has survived, and she has been with us for the past 27 years since that diagnosis. She has seen her kids, including her little boy, that's me, grow into my best attempt at an adult. She has seen her 14 grandkids born, and recently she welcomed her first 2 great-grandkids. Unfortunately, a couple of months ago, and just after her 27-year anniversary mark from her first diagnosis, we all got the news that cancer is back. So all of these videos on our channel mean a lot to me and to our company, but this one in particular is fresh and it's raw, and I sincerely hope that it helps those of you who are watching. Now, these cost estimates are coming from her claims. They are not guesses. I will be rounding costs to the nearest dollar amounts with a couple of exceptions. You could see different costs depending on where you live, the facility that you choose to get treatments, the type of cancer you get, and several other variables, but this will give an example of what it could look like. I will compare original Medicare only with a supplement plan G and 2 different Advantage plans, one with a $5,500 max out of pocket, which is the average in our neck of the woods here in the Intermountain West, and another with a max out-of-pocket of $3,000, which is closer to the average max out-of-pocket between our 5 surrounding states. Now, I get comments all the time trying to accuse us of some sort of bias in these cost comparisons. I can assure you that there is no intentional bias. These whiteboard comparisons are looking at dollars and what options that you have. In these cost comparisons, I can't bring up every exception, nor is this a video about the ease of use, networks, prior authorizations, or anything else other than dollars, assuming that the plans work as they should. If you are looking for that kind of information, it is not here in this video, but it is in other videos on our channel. Finally, there are specific cancer policies available, and for many who choose to go with the Advantage plan route, they choose to get a cancer policy as well for reasons that you will see here in this video. All right, similar to what we do in all of these videos, we need to look at your monthly premiums, which are your fixed costs, whether you need to use the healthcare system or not, and your deductibles. Whether you go with original Medicare only or a supplement plan or an Advantage plan, you will have a Part B premium. That amount is income-based. The higher the income you have, the more that premium could be. Those with low incomes, think Medicaid, could see lower numbers or even no premiums. But for most people, that number is $164.90 per person per month here in 2023. That number could be different if you are watching this after 2023. So regardless of what option you choose, you are going to be looking at a Part B premium of $1,978.80 for the year, plus or minus depending on your income. And I'm just going to round that to $2,000 just to keep things easy. Now, there are Advantage plans out there that will give a Part B give back of sorts to lower your Part B premium responsibility. These are not available everywhere, and they are more the exception than the rule, so we are not going to factor that into this video. Now, what about your premium, just to have the plan? This applies to the supplement plan and some Advantage plans out there. For a plan G, in our area, the average is $150 per person per month for a 65-year-old. That number does typically go up each year as you get older, so this is another $1,800+ per year. Most people on Advantage plans, and by most I mean 70%, have $0 premiums. They don't pay a monthly premium to have the plan. All right, for those cancer policies, these exist for when, like the name suggests, somebody gets cancer. There is a benefit amount. Most people choose to set that amount to be around or about their Advantage plan's maximum out-of-pocket number. In our case, plans are available for a $5,000 benefit as an example. There are some that are lower, some that are higher. So if you were to get diagnosed with cancer, your cancer policy would pay you a lump sum payment of $5,000 or whatever the benefit amount is that you picked. You could still have that same amount if you had a lower Advantage plan max out of pocket like the $3,000 one. It doesn't have to match your Advantage plan out of pocket maximum. In our area, the premium for this plan is about $20 per month or $240 per year for that $5,000 benefit. A lot more detail on these plans are in other videos on our channel. All right, for this example, original Medicare has the Part B deductible you need to worry about once a year. Supplement plan G has the same deductible, and most Advantage plans do not have a deductible. So you get the news that you or a family member have cancer. Here's what our family is seeing. There are quite a few specialist visits. In our first month, there were 4. Each subsequent month, there have been 2 visits a month. And I'll extrapolate that number to a year and say that there will be 28 specialist visits in this year for my mom for various things that are happening. Now, as I talk about costs, know that there is a billed amount. It is a big number that the hospital or the physician sends. There is a Medicare approved amount, which is a lower, call it negotiated amount, which is more of a, hey, if you participate with Medicare, we're only paying you this much. There's how much Medicare actually pays, which is 80% of the Medicare approved amount. And then the patient or your responsibility, which is 20% of the Medicare approved amount. The costs that I am using in this video are not the billed amount, they are the Medicare approved amount. Also, the insurance companies that offer Advantage plans negotiate different allowed amounts than Medicare. These are typically close, tending towards a little bit more than the Medicare approved amount, but not dramatically more, and can also vary dramatically. If there's a $700 Medicare approved amount for a charge or a service, the Advantage insurance company could be $710 or $750. It's likely not going to be something crazy like $3,000. So they're close, but the Advantage plan rates are just a little bit higher typically. All right, the average for the specialist visits that we are seeing is $125 per visit. We're estimating 28 of these for the year for a total of $3,500 this year for specialist visits. If you have original Medicare only, you're responsible for your deductible of $226 and then 20% of these costs. After the deductible, that puts you at about $655 in specialist visit coinsurance. For the supplement plans, you still have that $226 deductible, and then after that, your Plan G covers the rest. For the detailed folks who like to find holes, we sincerely love your insights. That $226 is going to be spread across several doctor visits and other procedures, but for simplicity, we're putting that into this row. Now, when it comes to both of these Advantage plans, the average specialist visit copay in our area is $25 per visit. Multiply that by 28, and we're looking at $700 in specialist visit copays throughout the year. Next, we had a minor outpatient surgery as part of her treatments. This number could be all over the board and usually much higher than this, which would likely only affect those on original Medicare only, in our example by pushing their costs up higher. But the Medicare approved amount for this surgery was $2,300. If you have original Medicare only, Medicare will pay 80%, you will pay 20% or $460. Supplement Plan G, you have met your deductible, so you don't pay anything. For the Advantage plans, the average outpatient surgery copay in our area is $325. Now let's talk about chemo treatments. In our example, they happen every other week for the foreseeable future. The total annual projection will be $95,000 in Medicare allowed chemo treatment costs billed under Part B. Another family member of mine is also going through chemo, and this person has weekly infusions and daily pills. The costs are much higher. Others will have less frequent chemo that will only last a few months, which would mean much lower costs. So this, again, can be all over the board in terms of costs. For our example, if you are on original Medicare only, you are responsible for 20% of the $95,000 number, or about $19,000. With a supplement plan, you are all covered. That was easy. With an Advantage plan, most have a similar 80% coverage, 20% coinsurance arrangement, so you are looking at $19,000. However, remember, we have a maximum out-of-pocket with these plans. So if you have a $5,500 maximum out-of-pocket plan, you'll have about $4,475 in coinsurance costs for chemo. On the $3,000 maximum out-of-pocket plan, you'll have about $1,975 in coinsurance costs for the chemotherapy. All right, let's look at the totals and then factor in the cancer policy that we have. If you are on original Medicare only with your Part B premium, your Part B deductible, and your 20% coinsurance, you are responsible for about $22,340 to pay out of your own pocket. If you have a supplement Plan G, we have your Part B premium, your Plan G premium, and the Part B deductible, bringing your total to about $4,026. With the Advantage plans, your premiums and deductibles are likely $0. You still have the Medicare Part B premiums, and with your copays and coinsurance amounts, you will hit your maximum out-of-pocket in this example. So you would be responsible for that number, in this case $5,500 or $3,000, bringing the total to about $7,500 or $5,000, depending on the plan available to you. All right, so why do we include original Medicare only in these videos? Well, we get people who ask. And we also get comments around how original Medicare only is plenty of coverage and people don't need a supplement or Advantage plan. Insurance agents just force them into these plans because they want commission. And sure, if nothing goes wrong, they're right. If we knew nothing could ever go wrong with us and our health, we wouldn't even talk about insurance. The problem is, as far as I'm aware, none of us have a time machine nor the ability to know the future. So insurance is a protection against risk. The risk that if something does go wrong, costs don't get messy. And with original Medicare, if cancer happens, so far these costs, in my opinion, are a little bit messy. Now, in this case, you can see why Supplement Plan G is such a popular option. Once that Part B deductible is met, look at how low the stress level is. You have higher monthly premiums for the plan, but you don't stress over copays or coinsurance amounts. With the Advantage plan, you can see that your maximum out-of-pocket number matters. With some Advantage plans, strictly from a dollar perspective, not an ease of use perspective, the Advantage plan will be more costly than the Supplement plan. With others, it will be less costly. Now, if we had a cancer policy in this example, as soon as we are diagnosed with cancer, we submit the claim and receive a lump sum payment of $5,000 to use however we want. So with the $5,500 maximum out-of-pocket Advantage plan, our out-of-pocket cost for the year would be the Part B premiums plus the cancer plan premiums of $240 for that year, your maximum out-of-pocket minus the $5,000 sent to you as a benefit, bringing your total out-of-pocket costs on the $5,500 maximum out-of-pocket plan to about $2,700 for the year total, and $220 total for the year for the $3,000 maximum out-of-pocket plan. This is why we try to educate our clients who are wanting an Advantage plan around these cancer policies. They can make a huge difference in your cost responsibility and lower your risk for lower monthly premiums if monthly costs are the worry. Also, we do not cover Part D prescription drug coverage in this video. We will cover it and have covered it in other videos, but drug costs as part of this whole experience are handled separately. A Part D prescription drug plan typically is included at no additional cost in an Advantage plan. You would need to purchase one separately if you were to go the supplement plan route that has its own premiums, because supplement plans do not cover Part D prescription drug costs. Now, I know I'll get people yelling at me in the comments about details that fall outside of the dollar cost of these plans. If you are ready to jump into the comments to do that, you are more than welcome, but please go watch several of our other videos that go over the pros and cons of supplement and Advantage plans. That includes networks, ease of use, prior authorizations, agent commissions, denials, and a bunch of other details not directly related to monthly premiums, copays, and coinsurance costs. I promise we talk about these a lot, just not in this video. So if you made it this far, you should subscribe to our channel so that you don't miss those kinds of videos. If you found this video helpful, consider giving it a like and leave a comment around a type of situation that you would like to see covered in a similar comparison format, and we'll put something together for you. As always, I appreciate you watching, and we will see you in the next video.